Hi everyone, welcome to our live video today on the Brooke Surgery. I'm Dr. Arshad, and I'll be talking you through today earwax, and particularly why we shouldn't be putting things inside our ears like cotton buds. So I'm sure we're all relatively familiar with earwax. So what does it actually do? So the point of earwax is to protect the skin inside your ear. The wax actually assists in helping clean and lubricate the ear, so to prevent things like dirt and germs going in. Earwax becomes a problem when it starts building up. It can sometimes cause a blockage in the ear canal, and this blockage can sometimes actually press against your eardrum and block the ear canal. And sometimes it can cause ear pain or even problems with your hearing if there's a complete blockage. So the question is, what causes an earwax buildup? And as an individual, you might have a buildup of earwax due to a number of reasons. So sometimes we just naturally make more earwax. And earwax is natural. Other reasons can be if you have a narrower ear canal, so less wax is needed to cause a blockage, or if you have more hair inside your ears. So we do actually have hair inside our ears that help move the earwax along, and some people have more hair, which can cause a further blockage. Another reason can be if we're getting older in age. As we get older in age, the wax gets harder, and it's more difficult for it to fall out. And this is in part with some of the hair cells in the ear not working as well. And the other reason, and one of the reasons why we're doing this in video, is that can cause your earwax to get worse or cause a blockage is if people put things inside their ears. So there may be a very good reason for you to do so. So things like hearing aids is one, or earphones if you're someone who's using the phone a lot and you're having to put earphones in. Earplugs for those who find noise is stopping them from sleeping or traveling. But one of the big ones is cotton buds. As all of these things, because of the shape they are in, they can push your earwax further and cause more risk for you to actually get a blockage. So the question is, how can you tell if you've actually got blocked earwax? So some of the symptoms that you can actually get are earache. You can get difficulty in hearing, particularly if there's a blockage that's got a complete wall in front of your eardrum. Your ears can be more itchy. If there is a complete blockage, sometimes you can even get things like dizziness as well. And because of the nature of earwax and sometimes the way we respond to them, you can have an increase in ear infections. If you're popping your hands in or other things in, you might damage the skin cells, which then opens that up for infection. And also another symptom that people can get is difference in sounds. So you can get high-pitched tones coming inside your ears. So that kind of goes in with not hearing much at all to hearing sounds that you shouldn't do. And we often call this sound a tinnitus. So one thing that's worth mentioning is if any of these symptoms are because of your earwax, once the earwax is removed, your symptoms should improve. So can you prevent earwax from building up? Unfortunately, you cannot. You cannot prevent the earwax from building up because it actually has a role, as mentioned earlier, stops dirt and germs coming inside your ear. But there are things that you can do to reduce this impact. So the main thing to do is not to insert things inside your ears. Do not use your fingers, do not use cotton buds, because as I mentioned earlier, the shape of your ear canal, the cotton buds are more likely to push the earwax in. And I can make that a bit more clearer. So I'm going to just add a picture here. So if you can see here, you've got your ear, and as part of the ear, you can have the earwax at the front here. And if you use the cotton bud, you can push it further and further to where your eardrum is. And if you see here, this part's more narrow than this part here. So the more you use these, your fingers or a cotton bud, which can go further, the more likely you are to have a blockage. Okay, so hopefully that's given you an idea of why an earbud can actually push things further. And again, it can give you things like ear infections, which can eventually even damage your eardrum. And that can be quite a tricky thing because they don't always heal as well. So how can you actually get rid of your earwax? So typically speaking, earwax should fall out by itself. And this can be helped along by chewing. So when you're moving your jaw, it helps move things along, which is a good way to help it move. And wax move outwards. And the way we normally describe it, the wax moves outwards almost as quick as your fingernail growth is. So it gives you an idea that it's not very quick, but there is a gradual movement. If wax does not come out and blocks your ear, there may be treated in different kind of eardrops that you might need, which you can actually get over the counter from the pharmacy without having to consult anyone. So I'll tell you the first one and the most common one. The first one is either olive or almond oil. Now, if you put 2 or 3 drops of the olive oil in your ear, at least twice a day for about 2 weeks. Over time, it should actually soften your earwax, and eventually this will help your earwax fall out. So what you mustn't do is use the olive oil drops and then use a cotton bud, because as shown in that photo before, you might push the earwax further because you've now made it come away from the skin. A useful strategy to actually use the drops, these olive oil drops or almond oil drops, is to put it in your affected ear and then lie down on the opposite side and give that a few minutes to actually work. Because being stood up, if the earwax blockage is quite further out, what can happen is the olive oil can just trickle back out, and then it's not as effective. Now, if that's not useful for you, what you could try and do is warm up the olive oil ever so slightly. So the way people do that is get some hot water in a cup and put the olive oil, a little droplets tube into the hot water. Give it a little while, and before you put it in your ear, you must check it on your skin. So your skin on your hand is not as sensitive, but the skin on your elbow is. So if you were to put it on the elbow, you will know whether it's hot enough to be going in your ear or not. Similar to when you run a bath for a child, you want to check it with the elbow because it's more sensitive to heat. So if it's good for your elbow and it's not too hot at all, then it's relatively safe to go in your ear. So that's one option, olive oil. The other option is something called sodium bicarbonate. So whereas olive oil actually softens your earwax, what sodium bicarbonate tries to do is try to dissolve it. And you use it similarly. You use the drop twice a day into your affected ear, and sometimes the earwax dissolves completely or it falls out. The one thing to mention on top of that is that you've got to be careful if you ever had a hole in your ear, a perforated eardrum, or you have a suspicion that you have a hole in your ear, because the sodium bicarbonate is not friendly to the inner ear. So if you're unsure of which one to use of the two, go for olive oil. That's going to be your best option. So the title of this video was why you shouldn't use cotton buds in your ears. So hopefully you've got the message here, which is it can cause infections, make your earwax build up worse, and actually cause other problems as well. And hopefully what you've gained from this video is a few tips on how you can manage your impacted wax in your ear. So that's olive oil, sodium bicarbonate, and sometimes even giving it time. So for any of our viewers watching, if you're our patients and you've got some advice there, if you're a patient that's actually not belonging to Brooke Surgery, we are welcoming new patients here. It's quite easy to sign up. You just go on our website, brookesurgery.co.uk, and there's a sign up button in purple. So if anyone has questions, you can ask while this video is running and I'll get back to you. And if you have questions after the video, feel free to leave a message below and we will do our best to get back to you. So as our patients know, you don't need to call here at Brooke Surgery. You don't have to queue up or phone. You can just simply send in your online request and we get back to you on the same day, which is one of the great benefits of being here. So thank you everyone for watching. Looking for to see any comments that come through so far. And as expected, most of this video is relatively self-explanatory. But if any comments do come through, we will answer it, endeavour to do that within 24 hours. So thank you for watching, and tune in next week for our next video.